Welcome back to Hyperbaric Living Podcast. I'm your host, Dr. Masha, and today I have with me Dr. Lauren Mathewson. She's a naturopathic doctor. She's from Northern California, and we're going to talk about hyperbaric oxygen therapy, of course, cancer, long COVID, naturopathic practice, and probably some other conditions that could be treated with hyperbaric therapy. Welcome to the show, Lauren. It's really good to have you with me today, and thank you for being here.
Oh, I am so excited to be here with you. Thank you for having me on. I love natural medicine. I love integrative medicine, and I love chatting about it. So this is just delightful for me.
So you've been in practice for 7 years. You see all kinds of patients with different health conditions, and you specialize in integrative oncology.
I have done, and what has been so exciting for me in my career is I went through Dr. Anisha's Metabolic Approach to Cancer training. So I'm one of her trained metabolic practitioners. I love being a part of her network. She's doing such amazing stuff and kind of bringing us all together and giving us a chance to talk about the tools that we share and successes we've had is just incredible. So that's where I am.
That's how I found you, actually, through Dr. Nasha's network. And Dr. Nasha has been on the podcast before, so you can find episode that we recorded about hyperbaric oxygen therapy and cancer with her. And today we're sort of following in the steps of that interview that I did with her, because you follow her protocols. Is that correct?
Yeah, that's a really lovely little distinction and Nisha would love for me to kind of elaborate on that, is that it's not so much that it's a protocol-based program. In fact, it's the very opposite. It's more that, very focused on this kind of test, assess, address. So it is more the philosophy that we share and the approach to testing and tracking patients and kind of working with their integrative teams than it is kind of walking in and getting a protocol, which I think is not uncommon. A lot of places just kind of have like, oh, you have this type of cancer, you're going to get this set of IVs and this set of whatever, and you're going to go on this diet. What I love about Nisha and her team and everyone in that is that it is that very individualized. The person right in front of us is getting a very unique plan.
Because when we're treating a person, we're not treating a disease.
Of course, right? Yeah. And we can have two people with the exact same, stage of cancer, the same age, the same demographics, and they have totally different origins of kind of what led to their having a cancerian process. So it takes really deep diving into each person to find kind of the best tools and strategies that are going to work for them in that moment. And those are going to change as they go through treatment and kind of requiring different things at different times. But it's really a very involved team effort. So the patient is super involved with their treatment plans and takes a team, and it's wonderful.
For the folks who are not familiar with metabolic approach to cancer, can you summarize it in several sentences?
I would love to. So it is a shift away from the thinking historically that when people got cancer, it was because they just had a little series of random mutations accumulate, and now they had a cancer cell, and that cancer cell was going to divide. And I think there is still some foundational, the biology of that, there is still truth to it, but what we're finding is like, gosh darn, it's way more about the epigenetics than it is the genetics. It's way more about the lifestyle and the exposures, and specifically what's happening at a cellular level when we go from a healthy non-cancer cell to a cancerous cell. is there is a change in how that cell is going to use energy. And it goes from this just kind of normal glycolysis into this anaerobic fermentation. And that is that metabolic shift where we go from healthy to non-healthy cells. And that's where we can come in with this metabolic approach to cancer and really try to focus in and push against that metabolic shift. Really nutrition is foundational to everyone all the time, but especially our cancer patients, right? It's not enough just to say no sugar. We're going to come in and we're going to really look at getting our blood sugar very well controlled. And that might be a low carb or a ketogenic diet for a lot of people. And just trying to really take away anything that a cancer cell is going to find benefit from. It's basically making that patient's body as inhospitable to cancer cells as we can.
And hyperbaric oxygen therapy is a part of that approach.
It's a fabulous part. It is such a beautiful tool and layer to use with our patients. Just at a really, so specifically for our oncology patients, the hyperbaric chamber is going to be very specific at enhancing their metabolic and their mitochondrial function. And we want healthy mitochondria. Those are what are providing energy for our cells. When we shift into this unhealthy cellular state, it's unhealthy mitochondria. And hyperbaric is this really very specific way to come right in at the cellular level of every single cell in the body, right? We can access every cell, which is phenomenal, and put pressure on that cell to resume a more normal, healthy metabolism. And not even counting all the other amazing, wonderful kind of side effects we have, the anti-inflammatory benefit, the endothelial function, just the gosh darn feel a little bit better after being in the chamber, hyperbaric I've found is a really lovely tool to incorporate for a lot of my patients. And it could be for different things for different folks as they're going through kind of their cancer process, right? So if I've got someone that has just had a surgical repair or they've just had a mastectomy, we're going to talk about hyperbaric in terms of, okay, really specifically right now, we're going to try to heal from that surgery. We want to stack the deck in their favor. We're going to do nutrition. We're going to maybe talk about hyperbaric, maybe some IVs. If I've got folks that are kind of dragging, we've got a post-treatment picture, they've wrapped up their whatever was recommended, and we just are having a hard time getting energy back on board, right? And we've done some of our fasting, maybe for detox, and maybe we've used some infrared sauna, and then we say like, gosh, your energy is really not coming back the way that we want it to. What are tools that we can use to come in and get really specific in that area? And especially if I'm thinking, I wonder if we've kicked up some background opportunistic viral things that are kind of draining this person's energy reserves a little bit. It's really common to have these sort of opportunistic viral background viruses that have been under control, and then we have a stressor to our body and they flare, and now we've got this fatigue picture. So kind of a flaring of chronic Epstein-Barr, things like that.
You've mentioned that hyperbarics can be used for different reasons in cancer patients or in cancer diagnosis. And you've mentioned that, for example, to heal after the surgery. Where else do you throw in hyperbarics? Like who else would benefit? Sure.
So if I've got someone who is doing I've really got them on board with our metabolic approach, and I've got them tracking their ketones and they're in ketosis and they're being really thoughtful and careful with their diet, and we want to put more pressure kind of in their system on their pathology, on their cancer cells, then that is a beautiful time to introduce some fasted hyperbarics for them. What's important here is, again, is anyone any of my patients that are in an active cancering state, if I put them in the hyperbaric chamber, I'm going to ask that they are fasted when they go in there or in a very low blood sugar state. Like if I haven't gotten them to the point where they're able to fast for comfortably 12, 14 hours, then I might say, okay, fine to have a little bite of protein in the morning, but I do not want you eating a big bowl of oatmeal and then getting in our hyperbaric. I want this low blood sugar. Because it puts this extra pressure on their cancer cells. It also lowers that possibility that we're going to drive tumor growth or angiogenesis, the development of blood vessels that feed masses, right? So that when someone is fasted, I say, I'm not concerned about that. And I'm getting this extra metabolic pressure against their cancer cells. I'd love it if I can get my patients to get out of the hyperbaric chamber and stay fasted for a few hours that afternoon, that evening, if they can. I would love that. I'd love it if they did that a couple days a week, really depending on where they are in their disease process. But what's worked really well for a lot of my folks is to get them set up with an at-home hyperbaric chamber. And then they can do treatments in the morning. They're not having to come into my office, and it's just available right there for them. So we have a lot of good luck with that. I love pairing hyperbaric with high-dose vitamin C, which should be super obvious right off the bat. Yeah, that is one of my favorite combinations for a lot of folks. We've found there's this enhanced synergy when we pair hyperbaric oxygen and high-dose vitamin C within a handful of hours, within about 4 hours. We get kind of this enhanced benefit that we're not getting when we're doing those treatments individually. So I love it when I can get folks to come in, get in the hyperbaric chamber for an hour, get out, do their high-dose vitamin C, and if I can get that treatment going a couple times a week, it delights me. So I use a lot of hyperbaric with my IV therapy. I love those tools together.
And in terms of time inside the chamber and pressure, how long are the treatments?
I've only ever had access to a soft wall chamber. So my only experience is at that 1.3 atmospheres and down. And I've found that to be absolutely sufficient and totally beneficial for what I'm using it for. I know that the harder wall chambers can go to a higher atmosphere, and that might be something where patients would go do a very specific protocol in. But for the most part, what I'm using it on my soft wall is doing a great job. I'm, for the most part, putting folks in for about an hour at a time. And again, everyone's individual, but this is one of those therapies where I'm like, I would prefer to use this a little more frequently as opposed to a little less. I'm watching patients for signs of too much oxidative stress. So if they're in the chamber 5 days a week and they're doing a bunch of other oxidative therapies, I'm going to be keeping an eye on them and making sure that we're kind of not pushing them too hard. But I'm also using a bunch of antioxidants with most of my hyperbaric patients. So we're kind of getting that oxidative pressure and then the antioxidants in the evening to pulse back and forth.
And what specific signs and symptoms of oxidative stress are you looking for?
I'm just kind of looking at their overall, how did they appear to be doing? What's their energy level like? When they check in with me, does it feel like we're heading in the right direction? Or did we plateau? And maybe if we're slipping, I'm going to kind of pull back and say, oh, maybe we take a pause on our heavy oxidative and we just do some nourishing, maybe do a bunch of antioxidant IVs, handful of them, or just kind of do a rebuilding for a week or so, couple weeks, and then kind of come back to our therapies. There's not anything super definitively that I can see in their lab work that's going to give me an indicator of oxidative stress. I mean, there certainly are markers that will shift around, but I'm really kind of watching the patient mostly.
If your patients are going currently through chemotherapy and radiation, do you use hyperbaric oxygen treatments to go along with that?
It depends. It really depends on that patient, and it depends kind of on their vitality and how robust they are. With any of my treatments that I'm doing, whether it's IVs or even kind of infrared sauna, I'm a little conservative and I space those apart by a couple days after any chemotherapy infusions, or I'll slow down on those like maybe a couple days before. I just want to give the kidneys kind of as much of a chance to do what they're going to do when they get those infusions. But I absolutely will use hyperbaric in between or on my chemo off weeks. If I'm going to be going through a bunch of radiation, I might use my hyperbaric maybe on their off days. I might wait until the end, do a fast, and then do a bunch of hyperbarics to kind of clean up on the other side. It just really depends on them and kind of if they look like they have the vitality, then we're going to go for it. If not, we're going to kind of wait and build them up on the other side a little bit.
Do you find that there are contraindications for hyperbaric therapy in cancer world?
I don't find that there are any in particular that don't apply all the time. I basically tell folks like, you can't have collapsed lungs when you go in there, and I don't want your ears to be stuffy because it'll be uncomfortable when you come up and down from pressure. But I would say my contraindication for my cancer patients would be if their blood sugar is elevated and I can't get it under control. If they've got just sort of we can't get them out of the high blood pressure or blood sugars. I hope I was saying blood sugars. If their blood sugar is elevated, I want to get that stable before I pop them in the chamber. I certainly, in some folks that I've been kind of on the edge with, or I just felt like needed a little extra bump, I'll use things like exogenous ketones before I put them in the chamber is sort of a extra layer of protection and to kind of ease their body more into that metabolic shift we're looking for.
And why would you be concerned if their blood sugar is too high up?
Driving angiogenesis, which is that development of little blood vessels that feed tumor and cancer growth. So we say, that's the one population we really don't want angiogenesis in. And we know that going in a fasted state, we're just able to walk right around that concern. We say, okay, we're not worried about it. If blood sugar is low, we're not concerned about angiogenesis. I prefer if all of my patients are getting in the hyperbaric chamber with stable on the lower side blood sugar, but I prefer that all of them have stable lower side blood sugar, period. So I am biased metabolically when it comes to my recommendations. We want things stable and lower.
Perfect. Thank you, Lauren. Thank you for sharing your experience. It's really valuable. As I said, there's not too many naturopathic doctors still for practicing hyperbaric therapy, but we're getting there because it's a natural, absolutely natural therapy. We're providing oxygen. It's a nutrient.
Yeah. Every cell needs it.
Absolutely.
It's been such an honor to be here with you. I am so grateful for what you're doing, and thank you.
Thank you. Guys, if you found this episode helpful, please give us likes because it helps us to share this information with more people and share it with your friends. And I'll see you next week.